TCM approaches to health betterment. The key thing about what we want to handle is called prevention, to prevent a disease threat. This statement is, to a lot of people, they feel like the prevention, how to prevent? But prevention is where, when you see nothing happen, your life being boring, when everybody else falls sick, means you are doing the correct thing. Actually, this is one of the statements I learned from yesterday when I attended the talk by our Prime Minister Lee Hsien Loong. When everything seems to be going normally, where other countries are suffering, nothing happened in Singapore, you must be grateful, because behind the scene, many things has been done. So similarly, when you do prevention, and you do proper prevention, and when everybody else falls sick, and you're normal, then that's okay. For example, 3 months ago, I talked about the weather will turn dry, will turn hot. A lot of people will cough. I'm not sure whether you follow. I have no cough, but there are a lot of people cough that help. So they call prevention. And to intercept before the pathological changes. When things happen, it happens. But question is, after it happens, what can you do to prevent further deteriorations? Take for example, should you be diagnosed with diabetic? Should you be diagnosed with hypertension? Should you be diagnosed with the high cholesterol? It's just a symptom being discovered. To me, all the chronic illnesses is an end result of something happened years before it happens. Your body has went through a period of deficiency. Your body failed to effectively metabolize the sugar over a prolonged period. Eventually, your sugar level high. At the moment you detect your sugar level high, it's called evidence-based. This is perfect. Modern medicine evidence-based. But the question is, should you wait to evidence to be happen, then you talk about prevention? Because all the chronic illnesses is an evidence-based of something deficiency over a prolonged period. And the prevention is where you can do something about it. And when to nourish after recovery from a disease. But those chronic illnesses that I mentioned, the moment you have it, from the modern medicine perspective, you have it for life. But from the other condition, for example, you have flu, you have a virus, these are time limit illnesses by itself. If you have a COVID before, as I mentioned, you have a flu before, the question is why you and not other people? Because you have a perfect body type for the virus to come in and thrive. So if that being the case, after you recover from the flu, recover from the virus, if you don't do something about it to mitigate it or improve yourself, the next flu come, you get it again. This is called relapse. So idea is, I believe you come across many individuals around you have 3-4 COVID by now. I still have 1 COVID here, so still far so good. So to nourish after the disease, after recover from disease, this is important because A plus B equal to C, A plus B don't change, C is the constant.